30 years ago, a virus from the other side of the world turned our world upside down. Busy streets emptied. New Yorkers banged pots out their windows at twilight to say thank you to the nurses and doctors, with faces lined by long hours clamped in masks. Sirens during that period never seemed to break for silence. Millions of people tried to work and learn from home. Updates to the race to vaccination and evolving theories of what the new normal would look like filled our conversations, which were all held at an appropriate social distance. Essential workers hoped going to work wouldn't kill them. Now, the signs on the ground marking 6-foot distances have faded, but we remember the 1.1 million Americans who died from the virus, even as we mark that the United States is lifting the COVID-19 emergency. Though, despite the change on paper, the virus isn't going away. Dr. Owais Durrani joins me now. He's an emergency medicine physician. Doctor, how does this affect officials monitoring nationwide COVID-19 cases and vaccine data? That was once so crucial and important during these last 3 years.
Yeah, absolutely. The ending of this emergency means that states are not required to report their COVID numbers to the CDC. And so the CDC is going to rely on different measures to kind of see what community spread levels are. Now, hospitals will still be required to share their admission data with the CDC. So that's going to be one kind of thing they look at. The other kind of main, way of surveillance that we've really developed is wastewater surveillance. And so they're going to be looking at wastewater levels of COVID-19 across the country to see where there might be a hotspot, where officials need to be on alert for. But it's going to be a different way of monitoring, but still monitoring what the virus is doing in our communities.
And how does this affect, if it does, someone if they are diagnosed with a new case of COVID or if they think they have COVID?
Yeah, quite simply, it's going to cost more, right? So right now you can get free tests, free vaccinations, and free treatments. Once the supply that the government has currently purchased runs out at some point in this year, you're going to have to pay for it. Now, if you're lucky enough and you have health insurance, you might have a copay or small out-of-pocket cost to get a test or treatment. Unfortunately, about 8% of the country does not have health insurance. And so those folks are going to be in a tough bind. They're going to have to rely on their city, state, and health resources to see if they can get those resources, or they're going to have to pay a full out-of-pocket cost, which can get costly very quick. The other thing I'd like to mention is Medicare and CHIP programs are expanded under this federal health emergency declaration. Those are going to be now left up to the states, and some states are going to roll those back. So folks that were reliant on that might be in a tough bind as well. And then on top of that, if they get COVID, it's going to be a complicated situation.
Is it Medicare or Medicaid that's at issue here?
Medicaid.
Yeah.
Medicaid.
Was it? Yeah. Let me ask you this, Doctor. When you say something's going to cost more, what does that click in your mind when you think about, well, if it costs more, people might not do it, and therefore that will have negative effects down the road? How do you think that might affect, people getting sicker, or how community spread might change when people don't know that they actually have it?
Yeah, you bring up a good point. I've seen the ER every day that, I may have seen, or a colleague of mine may have seen a patient 2 weeks ago and they were prescribed a certain set of medications, and they show up and they're sicker because they couldn't afford those medications. Now, I think most people with health plans are going to be able to, get some type of care, but I'm really worried about that group that does not have health insurance that we may prescribe an antiviral for COVID. They may be in that high risk, and that antiviral might cost them a few $100s that they just don't have, and they might show up sicker. And so even though it's the end of an emergency, as an individual, this could still be an emergency for you if you, unfortunately have a high deductible health plan or don't have health insurance at all. And so it's going to be very important that as a nation, from the federal level all the way down to the city level, we find solutions for that problem.
Dr. Owais Durrani, thank you so much for being with us.
Thanks for having me.